Hello, good morning, everybody, and welcome to the final day of Public Service Innovation Week. We have a fantastic agenda for today, and today's session that I'm moderating is entitled Our Virtual Workforce, RPA in the Public Service. The question and answer function is open, so please put your questions to speakers. I'm delighted to welcome our participants today. Kevin Kelly is the head of digital innovation at the HSE's Health Business Service, and he also has the illustrious title of the RPA Centre of Excellence Lead for the HSE. We also have Aisling Curley, who's Principal Officer at the Department of Education Pensions Unit, and Kate Waterhouse, who is the Assistant Principal in the Pensions Unit there. And they're going to tell us about their first foray into the world of RPA, which was actually backed financially by the Department of Public Expenditure and Reform's wonderful Public Service Innovation Fund. We're also joined by Louise McKeever, and Louise is a Principal Officer in the Department of Social Protection. And Louise also recently embarked on DSP's RPA programme. And I think you're going to see that this has really impacted on the lives of our citizens with the work that Louise has done over in the Department of Social Protection. So our four guests today are going to talk about RPA and their adventures, having prosecuted this particular program throughout COVID, or having put in place solutions that have helped our organizations deal with COVID and make our citizens' lives a little bit easier during this pandemic. So I'm going to start off, first of all, just by talking to you about RPA. I'm going to tell you what it is, what it's not, what the benefits are, and I suppose how you can access RPA services. So if you can see my slides there, my name is Philip McGrath, and I work at the Department of Public Expenditure and Reform, where I lead on public service innovation policy. And one of the areas I deal with is emerging technology and trying out new technologies to improve services for our citizens. So if we go to the next slide there. Okay, so what is RPA? So effectively, RPA is just a piece of computer coded software that you put onto your hardware. And what it does is it acts like a human being in executing processes. So it goes into systems and applications in the same way as a human would. So you give it a username and a password, and it goes in the front way, in the exact same way you would. So if you have a legacy system like Lotus Notes or whatever it may be, you put in your username and your password, and you can get into it, and then you can do the same in your SAP application or whatever. So that's how it works, and it can jump between applications like that. It's a program that replaces humans that are performing repetitive, mundane tasks. It's cross-functional and cross-application macros, okay? Unfortunately, it isn't, and this is the sad bit, there are no walking, talking Autobots. There's no physically existing machines that are processing papers. And it's not actually artificial intelligence. It's on the spectrum of intelligent automation, but it's sort of down the lower end. It's not a artificial intelligence at the higher end of that spectrum. So what can RPA do? It's great at opening emails and attachments, logging into web or enterprise applications, moving files about and into folders and saving files, copying and pasting data, filling in forms, reading and writing to databases, scraping data from the web, connecting to system APIs, making calculations, extracting structured data from documents, and collecting social media statistics, but really following if-then rules, okay? So, if something happens, then this is what you do. So if we move on to the next slide there, what are the benefits from RPA? So what can you get from using RPA? And really what it's great at is managing peaks and volumes. So those sort of peaks and troughs that you may experience throughout the year with your processes, it's great at that. So temporary workers, because this is your busy season, you can rely on robots to do that. It's great at data at the source. What it really does as well is it improves the quality of data, so there's less time required for handling processes. The improved data accuracy and reporting is fantastic. So one of the, I suppose, the byproducts of RPA that we found is that it has given organizations much better business information upon which to make decisions. It frees up the capacity of our people to do more interesting work, and that is the big seller with RPA. So people are no longer spending 4 or 5 hours working on mundane, boring, repetitive processes and can look to do those more value-adding tasks. And it provides flexibility. But I suppose really key to it all is it is great at generating efficiencies as well and making services more effective for our citizens. Some of our public service deployments there, so we have it working away in the NSSO, National Shared Service Office, the Revenue Commissioners, and both those organisations have centres of excellence. Our other two pilot organisations from 2016 were the Property Registration Authority of Ireland and the Public Appointments Service, but it's also working away in the Department of Foreign Affairs and the Passport Office. So robots are involved in producing those passports with those really, really good turnaround times. And it's also, it's now working in the National Transport Authority and the RSA. So if we move on to the next slide, we have a single supplier framework. So we have one implementation partner, and that is Deloitte. And we have a really good working relationship with them, and they have been very, very good, I have to say, from our perspective. And Louise and Shane over in Deloitte really have made this easy for us in terms of implementation. There are three licenses that are available. They're UiPath, Blue Prism, and NICE. And we have put in place a framework with our experts and our great friends over in the Office of Government Procurement. And I have to give a big shout out to Derek Melia over there, who really helped us put this together, and John Cummings, and they've won a civil service recognition award this year for the great work that they've done with us on that piece of work. But the framework that's available, which means you don't have to go through any procurement hassle if you want to do RPA, because we will provide you with the supply and renewal of RPA licenses, the provision of RPA training, and that's really important to us because we want to upskill our own people in this. We don't want to be reliant on external partners. The provision of RPA software vendor technical support. So the guys over in RPA will help your people to become experts in this stuff by showing you, where you made a mistake or, where you can improve. And then the provision of RPA and RPA related consultancy service. So if you want to set up a center of excellence or you need to move to a different technical environment, they'll help you with that. So if we go to the final slide then, these are some of the services that we provide in RPA. In the Department of Public Expenditure and Reform. Our contact details is there, and a massive shout out to John O'Donoghue on my team, who does all of this work and is engaged all the time with public service bodies to bring them on board with RPA. So that's really what RPA is. That's the value it can add, and they're the services that we provide in Deeper. And I'm going to move on now, and I'm going to hand you over to Kevin Kelly, who has that illustrious title of the head of the Centre of Excellence for the HSC's Robotic Process Automation Centre. So over to you, Kevin.
Thanks, Philip. Yeah, it sounds wonderful, but it's been we've had quite an interesting journey on with RPA. I suppose we've been looking at this for a couple of years, but over the last 12 months or thereabouts, a number of things have happened, namely the establishment of the framework last summer. And then I suppose we were lucky to receive funding assistance from Deeper towards the end of 2019. So, sorry, next slide, please. So we were examining a number of processes during the year to pilot, and we selected two, one in HBS Finance and another in HBS HR. So with the funding in place, we drew down the notification to activate services from the framework in November. And then a week before Christmas, we commenced our engagement with Deloitte. I suppose we were fortunate. It seems madness really to start something so close to the end of the year, and especially leading up to Christmas. But I suppose we got lucky, and I'll explain a little bit more about that in a slide or two. But we commenced that engagement and hit the ground running first week in January. By the end of February, both of those projects were in production. And next slide, please. Just a little bit about each of those automations then. So in finance, we were automating a routine which was done manually previously, whereby we were receiving spreadsheets monthly from each of the 49 acute hospitals around the country into our finance income services division within finance. Multi-sheet spreadsheets, quite complex, and having to sift through that data and upload the data manually into our finance portal. So that piece of work was automated, and we were able to reduce the processing time on that from 22 hours down to 2 hours. I suppose it was quite a stable process. We selected it. It wasn't a high volume as such, but it was quite a stable process, and it was low risk with it. But what it really did was gave the team confidence and gave us all confidence in RPA itself, and allowed us to step forward. Next slide, please. In parallel, we also automated a process in our National Personnel Records division in HR. This team in particular their role really is at the end of the Garda vetting process. Their role is to update our personnel records, each staff member's personnel records in SAP with their vetting status. So monthly they would have received a spreadsheet containing tens of thousands of records from the Garda Vetting Liaison Office in Leitrim, with the results and the update of each employee's vetting status. As I say, it was a manual effort to upload that data into SAP, and we've seen remarkable outcomes from that. We were able to reduce the time for each process from 10 minutes down to 30 seconds. And that team they've released 500 hours per month back to the members of the team to deal with exceptions, to deal with other queries and customer facing activities. I suppose we were fortunate, and I mentioned about starting a week before Christmas. We were quite fortunate with this process in that we finished in around the end of February, beginning of March, just as COVID was starting to hit the health service. The introduction of new medics and new interns drew a higher volume of Garda vetting requests and increased the volume of activity that team had to do. But with the automation in place, and it was literally in place a week or two before the deluge came, they were able to handle that additional pressure. Coupled with that, they had already leaned their process, and that's something we find quite important, that we would use Lean and Six Sigma principles to improve or make more efficient a process before we automate it, rather than just make a bad process faster. So they had already leaned that process in advance, and then that was applied through the automation. So rather than this being a monthly process, it became a weekly process. And the upshot of all of that really was that it allowed us to get those medical people at that time of emergency into post a lot quicker than would have been the case previously. So as I say, we got fortunate that we selected this process, but I suppose we were emboldened then by that and started exploring opportunities for other automations. So next slide, please. So that brought us up to around March or thereabouts, and we were all, I suppose, the sky fell in on the HSE to some extent, and we were all diverted to other work at that time. But again, there was a lot of interest in automation and getting work done faster, and we saw the Mater Hospital engaging with UiPath in their infection control labs. We had a lot of requests from other parts of the organization, and I've listed some of them on screen. And again, the recruitment drive that Minister Harris announced, we were able to respond to that because of the automation in the Garda Vetting Office. I suppose the next step for us really was to build a scalable platform then where we could take on newer automation. So I went back to Philip, cap in hand, and was successfully given additional funding, and we were able to create or put in place an enterprise platform to run our robots through a scheduler. So we used the UiPath orchestrator for that, and Deloitte, again, the team were magnificent, came in and enabled this for us in a very short time frame. Next slide, please. One of the organizations you saw on screen there, the Health Protection Surveillance Center, who were and are still at the very heart of the COVID effort, reached out to us, and we've been working with the Health Protection Surveillance Center since around April or May to automate a process that was consuming a lot of their time of their surveillance scientists and their people in public health. So the Health Protection Surveillance Center receive notification of positive COVID-19 cases, and they have previously had to manually upload that data into their computerized infectious disease reporting system. What we have done is automated that process such that we can automate the upload of that data from the labs, and also then the enhanced surveillance data coming from a CRM system within the HSE into the CIDR system, and that can happen overnight, releasing the HPSC scientists and the public health staff to do the work that they should be doing when they arrive into work. I mean, there was remarkable savings again achieved on this. The time to complete process reduced from 26 minutes down to just over 3. And we're estimating now that for every 100 cases processed by the bots, we're releasing 38 hours of admin workload back into public health and the HPSC staff. So next slide, please. So, you know, those robots, again, and all of those 3 processes were running off the scheduler. It was an on-premise scheduler built for us by Deloitte, and with the assistance of our own office of the Chief Information Officer. But I suppose, you know, given the demand and the pent-up demand that we were receiving for automation, we realized that there might be a better way of delivering this as a service. So our Health Shared Services division has now taken this on as a shared service to be delivered out across all of the public health sector. So we had decisions to make around the structure and the format of a centre of excellence in that model, and there are options in that. But given the design and the structure of the HSE, we have opted for the federated model. There are a number of advantages and disadvantages to each of the 3, but we have allayed the disadvantages associated with the federated model. You can see it on screen: increased cost, discrepancy in implementation, and so on. By building a single central architecture that will be available, and a governance model that will be available for use by all of public health sector. So next slide, please. So how this looks then in reality is we will create the center of excellence at the center. What that means is we will be standing up a single infrastructure. We are designing that at the moment and building that in the Microsoft Azure cloud environment. That will give us far better integration to all of the public health sector. It will be a hybrid model in itself, in that some elements will be in the cloud, other elements may have to remain on-prem, but that design is in play at the moment. The beauty, I suppose, of this model is that it will allow us to drive automation at scale. The center doesn't become a bottleneck, and that was really important to us. We want whatever entities want to run fast on this, we want them to be able to do so. Others who follow on, we will bring them through that process. We will absolutely encourage people to stand up their own centers of expertise within their own, whether it be a hospital group or a community area. So what you see on the model there are delivery hubs, and we don't know yet how many delivery hubs we'll have. We have quite a few entities expressing interest in creating their own automation teams within their own structure. And there are skill sets that they will need to employ into that, whether they train up existing staff or recruit. But there are new types of jobs available for staff, and we have partnered with the HSE Digital Academy to establish a training course or a training program to upskill our own staff in this area, in the areas of business analysis, in the areas of RPA development, and so on. But I suppose the advantage of this process we found was that it avoids duplication. We have a single central architecture. We have a single purchasing license agreement for RPA licenses, which will be available for use by all of the public health sector. We will have a single approach and methodology to automation. In terms of the technology, we've centralized costs, single model, the security structure will be similar throughout. So we won't have ad hoc implementations of RPA happening across the organization. And then on the people side, as I say, the Digital Academy have already started a training program. We're also looking at developing links to academic institutions to look at maybe apprenticeship schemes that we can tie into as well. So next slide, please. The services then that would be provided by the Centre of Excellence, and as opposed to the local delivery hubs, I suppose that single infrastructure and platform with all of the necessary security sign off by our data protection officer and ensuring that all privacy impact assessments are completed. We will be able to create secure areas within that platform for those local delivery hubs to build, manage, and then maintain their own robots. I suppose it's not a command and control model, if you like. We will release licenses as required to those various entities to do what they need to do in terms of their own businesses. We will establish an office that will support all of those subsidiary automation activities, all of those fringe activities around opportunity identification, creating the business cases, doing the PIAs, helping the local delivery hubs to recruit their staff in. And really, we want to establish a community of best practice here, where we will allow a culture, enable a culture of knowledge sharing and collaboration, even down to the technicalities of writing code, where we can share components right across the health organization. The business partners then in turn will, they will be required to identify RPA opportunities within their own business areas. They know their business better than anybody else, including ourselves. So they will be able to determine what needs to be done and when. Of course, our governance committee at the centre, which our Centre of Excellence will report to, is a representative group, and it will always make sure that the program is aligned to organizational strategies, namely Sláinte Care in the area of health. The business partners may, if they wish, establish local delivery hubs, but that's not an absolute prerequisite. Some organizations may not be large enough, may not have the scale to justify that. And again, we will work with those business partners to deliver automations with them, whether they have local delivery hubs or not. So next slide, please. So I suppose the work we have to the end of this year then is to flesh out and build out that cloud-based architecture. We want to then create those secure environments for the local delivery hubs as they stand up. We want to firm up and work is ongoing on this at the moment in establishing the operating model, the methodologies and so on that will be employed by all parties in this, the Centre of Excellence and the local delivery hubs. The pipeline of delivery then, we want to identify opportunities. There are some really quick wins at a local level, I guess, but also some really national projects that we can chase down. There's a number surfacing already, which would be of huge benefit. If we can achieve the same level of success we've had with the pilots and in HPSC, there are some other remarkable projects lining up at a national level that we're really keen to chase down. Of course, the robots need to be managed and they need to be scheduled. They need to turn up for work on time. We don't want robots leaning on shovels, as I say, so we want to sweat our assets. We've made an investment in licenses. We want to ensure we're squeezing every available minute that we can out of those licenses. And then, of course, with the work we're doing with the HSE Digital Academy, through the training programs, through the communications program, we want to just keep getting the word out there and let everybody have it in their head that there's an opportunity for each and every staff member to have a virtual assistant at some point in the future to take that mundane and repetitive work that they don't enjoy doing and which eats into the time that they could spend doing far more efficient work. So I think that's it from me. I'm going to hand back to Philip now, and thank you very much.
I think that's absolutely astounding when you see those figures, 38 hours per 100 positive cases at a time when unfortunately we're seeing 1,000 or 1,100 cases. You're talking 380, 420 hours per day being saved, and that is massively impactful in terms of the national response to COVID-19. So I have to say, well done to yourselves and obviously the people in HPSC for standing that up. We're going to move over now to our good friends in the Department of Education, Aisling Curley and Kate Waterhouse. From the pensions unit there, and they're going to tell us about their experience in doing their first RPA project and how they got it up and running and how it's working out for them and maybe where they're planning to go in the future. So over to you, Aisling and Kate.
Thanks, Philip. I'd like to thank Philip and his team for facilitating this talk. It's been really interesting so far listening to Kevin and listening to Philip's initial presentation also. In particular, I liked Philip's explanation as to what a bot is. And you talked about what a bot does and doesn't do. And from my experience, the way we view the bots are that they're new members of staff who work 24/7, don't take any tea breaks, they don't take any annual leave, sick leave, any sort of leave, and most importantly, they don't make any mistakes. So over the next 15 minutes or so, Kate and I hope to talk to you about our experiences, and we're going to literally take you step by step through what the problem was that the Department of Education and the pension unit in particular was trying to solve. We're going to talk to you about how we came across RPA. Again, we had no background in it. We don't have a tech background. How we came across the OGP framework, the implementation partners, all of that. And we'll talk you through the project from the proposal to outcome. Give you a little bit about the metrics, the self-sufficiencies that we now have and need to develop, and then most importantly, some insights into what we've learned, lessons learned, and where we're going from here. Next slide, please.
Thanks, Aisling. So first of all, just to give a little bit of context on the problem that we were trying to solve, the pension unit principally calculates and processes retirements and related benefits for teachers and non-teaching staff that are members of the department's pension schemes. So we're talking about a really huge volume, in and around 80,000 members if we talk about what we call pre-existing, which are prior to the single pension. So our work has over time become more voluminous, so it's not diminishing. It's also getting more complex. There are a lot of rules involved, but our systems haven't really caught up. So processes that are largely manual and very consuming. What you're seeing there on the slide is a representation, I suppose, of how the service history, which is at the heart of the retirement processing, is generated. So in order for a member of staff to generate a service history of a teacher or non-teaching staff, it can take anything from a few hours to a few days. It depends on how complex the individual case is. It depends on the records involved. Across the screen there, you can see there's a huge number of different paper-only records. So we've about 22 sets of individual records that are relevant. they mightn't apply to every person in every case, but you might have to check a number of those. And then we have also our electronic data. So we use 4 databases accessing 16 different screens. That data that's extracted is then keyed, and the pension rules are applied and calculations are done and so on. So there's a lot of work involved. It's quite complex, as I say, and quite time consuming. And when we have external developments, like something comes up like a pay increase, or in this case, COVID, that makes it even more complex. So retirements is a key part of our work, but it is only one part of our work. We do have a number of different functions that we perform, a lot of which also require service history. It's a huge challenge to be able to process all of the retirement and the other related work that we do. So we wanted to look at a way that we will be able to access and use our data more quickly and more efficiently. Next slide, please.
So I think my head hurts when I look at that last slide where Kate outlined the amount of work that's involved in assessing the amount of service a person has in order to inform their pension entitlements. So with that in mind, Kate and I went to a robotic process automation information session in the Athlone Institute of Technology last February. And it was organised by the Reform and Delivery Office. And through that, during one of the breakout sessions, we have a light bulb moment there where we realised the benefits that RPA could do for our organisation. In particular, they talked about if you had a project that was labour intensive and repetitive, and as you just saw from the last slide, we certainly had. They talked about how RPA could help on rules-based, underpinned by stable processes. And again, pension schemes have very defined rules, be labour intensive, but they're certainly clear on their rules. At the breakout session, we talked in particular about how if we had something that was IT-based regarding the input and the output, and then finally that it would involve assessing information from multiple systems. So it was at that moment in AIT, only last February, that we decided we would go for it. Great help from John O'Donoghue, in particular in the Reform and Delivery Office, because they gave us so much information as to what was involved and helped us along the way, put us in direct contact with Deloitte. And like Philip said, they're there in the framework, the procurement isn't an issue. So we had our first meeting with them back in February, and then the first proposal came from them in March. They put together what we were able to say we wanted, and they distilled that into technical language. Straight away, given that it was a March, into the COVID panic that Kevin mentioned there, and we more or less parked the development of the robotic processing automation, thinking we couldn't proceed with it. In particular, because our files and so on were very manual based. The processes involve an awful lot of manual processing. So we really thought we'd have to park it. Deloitte were fantastic. They came down to Athlone in their masks and socially distanced and worked through with us what we could and couldn't do. By the middle of June, we had agreed a final proposal as to what we'd want. We then went out, and we'll continue to talk about that in further slides. Just to say, it's been a very positive experience. It's been a very supportive environment, which is really important to any of you thinking of embarking on it. It's the combination of the support from our colleagues internally in the department, and in particular the IT unit. I mentioned at the top that neither Kate nor I have an IT background, so it's really important that you have the support from your IT, in particular from your IT unit. And then obviously Deloitte were fantastic in stepping us through. Next slide, please.
So just to talk about then what we did decide to do with our project, we did focus on service history and decided on advice we're only going to take little at a time. So we decided to take a small part of that service history and automate some little parts of that that weren't too complex to ourselves. Does this work and can we do it? As Philip mentioned at the start, at the same time as beginning our discussions with Deloitte, we put in an application for innovation funding from the Innovation Fund this year, and we're absolutely thrilled when we were awarded funding. I think it gave us a lot of confidence as well in going forward with this and in being able to say that the backing of the fund and that there was a belief in the ability of this project or the capacity of this project. So really throughout our conversations with Deloitte, we had done a lot of groundwork back and forth a lot of documents. And we had already done mapping the previous year of our workflows and our work processes in the section, which turned out to be very, very useful. And essentially, what we did was agreed an 8-week pilot project. There were 2 phases in that. The main part of it was our automation. We had a secondary part of it where we decided to scope what we might be able to do with that large volume of paper records that we have. But we're just going to focus today on what we did do, which was the plan was to get to the end of the 8 weeks and have a functioning bot that would be able to automate parts of that service. So we started in July. Again, like Aisling said, weren't really sure how it was going to work out with everything or most things being done remotely, but it worked really, really well. To take people through, I suppose, who haven't done this kind of a project, just the actual specifics of what it involved, we agreed with Deloitte a list of what they would deliver and what we would do together, a clear timeline. So we mapped out everything that would happen over the 8 weeks, especially where there would be key decisions and handover points. And really what it involved was analysing and documenting the relevant business processes. And doing that included really useful workshops with our own subject experts within the retirement sections, designing a solution, setting up the IT infrastructure, and then going on to actually develop the automation. So I suppose at the end of that 8 weeks and a little bit on, we have a bot that can parts of our service history. So we took about 4 parts of that, which would have taken anything between 20 and 40 minutes. And now the bot is doing that in 5 to 6 minutes. And also what we have at the end of it is really important handover documentation. You know, as everyone has it's very important that you don't hand over the whole work of the section to a bot, because what if something happens and suddenly you've forgotten how to work? So we have our current processes mapped. So if anything does happen, that information will be there so that we can continue to do it manually. Now, in this week, we're at the stage of testing it and making sure that it's working. So that's where we are right now. Thank you.
Next slide, please. So just to give you some scale, like Kate said, we now have a brand new shining bot sitting in the section, if you like. And like I said at the top, I consider this to be another member of staff who doesn't take tea breaks, who doesn't take any leave, and who will not make mistakes, which is really, really important. The bot will do what you tell the bot to do. I liked Kevin's expression that we don't want a bot leaning on the shovel. We haven't christened our bot yet. We're still testing to see what we can do. One of the top tips that Deeper gave us at the time, and John O'Donoghue in particular, was to keep it simple. When you're starting for the pilot, keep it really, really simple. And that was such a good piece of advice that we got, because now that we have established that the bot can do what we've asked it to do, we're now going to test its strength a little bit more and try and develop something further in the section with it. So just to give you some scale again as to what this bot will mean to us, if we take, and this screen is self-explanatory, if we take that to do the work manually, to gather the details required for service history, which informs how much pension a person gets, if we take a saving of 35 minutes per service history, that would take between 25 to 40 minutes for a person to do the amount of work. That in 1 year is about 52,500 minutes, because we retire annually 1,500 members of teaching and non-teaching staff from the department. So leaving aside statements or pension statements or anything like that, just for retirements alone, saving that amount of minutes is 875 hours. If you take an average of about 7.5 hours working per day, that is 118 days. And if we look at 35 minutes for 80,000 scheme members, if we talk about statements, we would save 2.8 million minutes, 46,667 hours, 6,306 days, which is 25 working years. It's kind of like monopoly money, it's monopoly time, but that is huge. That is hugely significant to us. So as I said, we can get lost in the technology and the detail and as to how we did it, but just to bear in mind that we now have a new member of staff that is going to give us such savings, and that most importantly, that the work will be completely accurate. That's a huge bonus to our organisation. Next slide, please.
We are, as I said, just at the very final stages of finalising the pilot project. we haven't, our hands are still being held, they haven't been let go of yet. So there's a bit of, I suppose, nervous anticipation about what that will be like. In our pilot project, it was very important to us to think ahead in terms of self-sufficiency and what we were going to do at the end of it. So we built in knowledge transfer sessions into that, where Deloitte was basically handing over the information and how they did it and what our bot was going to be able to do for us in both of our different phases. But as I say, we're at a very early stage. It's not really completely clear to us yet how it's going to work. We really are, we want to experiment. We want to develop the teams that have been working on this and that are working on this right now. Also, the pilot project is new for pension unit, but it's also new for our department. So it's a learning experience across the board, and there are conversations still to be had because, you know, there is more than just us in the department. So it remains, I suppose, to be seen where we're going to go in terms of really building that self-sufficiency. Next slide, please.
So just very briefly to share some insights and lessons learned from the experience. Just to remind you that some decisions are bigger and more difficult than expected. So for instance, choosing the RPA provider. While Deloitte is the consultant and they will talk you through, there's a choice of RPA providers, and we went with a company called UiPath, who are fantastic and who did a lot of work with pensions in the UK. However, that decision was much bigger than we thought it would be. And if I was to look ahead and looking back, maybe we didn't allow ourselves the time. We didn't want to delay the process. So it's just to be prepared for, that's quite a big decision to make between the three equally good service providers. To also understand maybe the decision to as to who will do what. You know, very quick, when you say it very quickly, we'll all look after it. We were very good at breaking down the work that the bot needed to do. And maybe we needed to take some more time to think of the work that we will do to enable the bot to do that. So we're a great team and we all worked really closely together. But maybe just those decisions as to who will do what is just something that we didn't anticipate to the detail that we should have. Another challenge will be delays. Obviously, the COVID delay couldn't be anticipated, but other delays, that sometimes things that you would think would take maybe 24 hours, a day or two, could take a week or 2 weeks. So just to factor that into the timeline that you're developing and not being too much or under too much pressure to deliver. Just take your time, obviously, to do it right. Also, to be prepared with the staff members and the resources. Like, we have a great team in the pension unit, as we have in the wider department. But I suppose to communicate to the IT people and to the rest of the department the support that you will need and to see the project through. Don't be overambitious at the start. Again, back to the good deeper advice to take baby steps and develop it through slowly and get it right, and then maybe expand where we're at now. Adaptability, again, we had no choice but to adapt to suit with COVID, no more than any of you listening. But we did an awful lot of our meetings remotely, and yet we stayed on target. So it's amazing what you can do. At the beginning of this project, we were all in-house, and yet we managed to get it through in relatively the same timeline as we had scheduled. So you really have to be adaptable. And finally, I just say, underline and underscore the support that you'll need from everybody. You know, you can't do it on your own. You really do need the support from the organisation, from Deloitte as a consultant, from the company and the provider that you choose, from Deeper. Take help from everybody that you can, because it all plays a part in developing the product. Next slide.
Just in terms then of what our plans are to do next, we want to build that expertise. Our plan is to, first of all, you know, start working on what we can develop in-house through doing and through training. We want to capture the interests and capabilities that the concept of self-selection is an important one, to try and get people to buy into the project and to, you know, ask people if they had interest or if they had expertise in it. And sometimes that the least expected people are both interested and extremely have a background that you never knew about. That could be really, really useful for this. We have a development team in the pension section, and we've had a fantastic Yeah, so just to say that, so we're planning to do some training to continue to identify processes that we can work with and to learn on the job as we're doing it, and also like this to share what we've learned with other people to hopefully help them think. That's it. Sorry for the delay. Thank you.
Thank you.
Thanks. You see, there's so much to talk about, obviously, and great learnings there. But we're going to rush straight into Louise McKeever from the Department of Social Protection.
Good morning. Thanks, Philip. And I'll try not to fly too fast through the slides. I probably will focus more on the technical aspects of it. So, as Philip mentioned there, my name is Louise McKeever. I'm a principal officer in DSP, and I suppose I have a nice position in the organisation where I get an opportunity to look at innovative technologies and how the department can benefit from implementing those. So I'm going to, I suppose, focus on the solutions that we delivered in the context of dealing with the pandemic. So next slide, please. So I suppose firstly, there's a date, the 12th of March, that I don't think anybody will forget. And on that day, the Taoiseach, our Taoiseach at that time, Leo Varadkar, made an announcement in relation to measures that the government was taking in relation to dealing with COVID-19. And the impact of those decisions meant that the pandemic unemployment payment was born. It was introduced on the 16th of March. Now, that was a scheme, a new payment, I suppose, payment model itself, and it was delivered in 10 days. And it was an emergency payment. And back in March, I suppose, when that was delivered, that payment was introduced, it was time boxed. It was meant to last about 5 or 6 weeks. And as we all know, the pandemic is still here, and the payment is still in place. So for PUP applications, I mean, at one point, at its highest point, it was around 700,000. And what we needed to, the plan was to move, or I suppose, transition from that payment into mainstream social welfare benefits or alternative income support measures. So this is where robotic process automation comes in and was developed. Next slide, please. So I want to talk a little bit about the solutions that were considered for RPA. They're all in the job seekers space. So job seekers is a payment that's made to people who are unemployed. And the actual scheme itself is administered on I suppose, a platform known as ISTIS, which is Integrated Short-Term System. So the RPA solutions were delivered around to support, I suppose, as I mentioned, the transition from PUP onto job seekers payments. So there were a number of solutions that we considered and actually delivered. The first one is around registrations for our verified customers. ISTIS updates, I'll come back to that one. Registrations for the non-verified job seekers, and auto award for certain cohorts, and also, I suppose, automating other kind of claim management opportunities. Next slide, please. So I'll give you a little bit of background, I suppose, about the framework. So with my other hat on, at the early days of the pandemic, I was engaging with other organisations like OGCIO, and what we were looking for is around, I suppose, staff to support a number of the initiatives that we had during the pandemic. And as part of that engagement, we had already started, I suppose, a POC in relation to utilising kind of RPA solutions. And we obviously wanted to completed that POC to upscale it. And we were put in contact with, and made aware of the OGP RPA framework, which Deloitte won and has been in place since 2019. And for us, that was fantastic because obviously with our procurement hat on, we had a framework in place that enabled DSP to get up and running very quickly. Next slide, please. So just, I suppose, some background around the timelines, just to give you an idea of how long it took actually to deliver the solutions. So I mentioned the 12th of March and the 16th of March when the payment was put into payment. And we had, in April, we started the POC. And at the time, we used Blue Prism and then moved to UiPath. And the reason for that was it was a better fit into, I suppose, the technology stack that we already used. And then Deloitte came on board in May. And it's very interesting because I suppose it was the first development team that was onboarded remotely. And that team is blended with existing teams already on the ground. And that worked really, really well. And then I suppose for the solutions, we went through a number of months and we had a number of deliverables right up until August, where we delivered our last solution, which is the Auto Award. Next slide, please. So I'm going to spend a little bit of time on this slide, and I suppose it's really just to walk through the technical aspects of how the bots interacted with our systems, similar to how an officer would. And it's really just to walk through the process of how the bots can actually, end-to-end deliver a fully automated solution. So on the left, you can see there's three actually platforms in play here. It's My Welfare at the top left, which is our digital platform for citizens. In the middle, it's the BOMI, which is the Business Object Model Implementation, which is actually our system of record or core strategic platform where most of our schemes are administered from. And then the bottom left is the ISTIS application, as I mentioned earlier on. So I'm going to talk in the context of three of the solutions that we delivered, which is for job seekers, it's the registration of our verified accounts, and for registration for our non-verified, and then for the Auto Award. So a customer would actually submit an application for a job seeker payment, and depending on whether they were verified or non-verified takes a particular route. And on the left-hand side, that's for our verified customers. And basically what an officer would receive is that online request for the application for a verified customer. What the bot did is actually interact with that online request, and using the platforms or a component between the platforms on BOMI and ISTIS would actually automatically register the claim. And a similar process would happen for our non-verified customers. The non-verified is a little bit more complicated. The bot had to do a lot more because of the fact that they're non-verified. So it registered the claim for a non-verified customer, but then do a bit of claim management and I suppose distribute those claims into various different organization units so that the officer who had to follow up for various different reasons, so that they could actually manage those claims quickly. And then the final component down the bottom right is the Auto Award. So at this point, the bot has actually registered the claim on BOMI, which is now on ISTIS as well, and actually goes in for a very small cohort and would actually automatically award the claim. Next slide, please. So yeah, just some of the benefits. If we can actually pull up that screen more in full screen, that'd be great. So really just to kind of give an idea of the timelines, and this slide is actually in relation to the non-verified customers. So from start to finish, I suppose the analysis took around 8 to 9 days. Development in itself was 3.5 weeks. The deployment and the hypercare was 3 weeks, and the reason for that is it went through, I suppose, a number of enhancements and changes. So we looked at kind of performance around, I suppose there was a backlog cleared pretty quickly, so we had an API built in there to actually be able to manage the latest claims in there. So just to give you background in relation to that solution, so the process for unverified customers, we processed 30,000 to date. There was 15 bots running at the time, which cleared that backlog in approximately 6 weeks. And currently, as we don't have a backlog at the moment, there are 3 bots running, and they can process approximately 300 applications a day. Now, the beauty of, I suppose, this solutions is that you can ramp up the bots and down. So as everyone is aware, we're in a level 5 restriction at the moment, and we have applications coming in, so we can ramp up those bots to make sure that those automatic registrations of claims are done as the applications come in. Next slide. So I'm not going to spend a lot of time, I suppose, on the Centre of Excellence because that was covered earlier on, but I suppose from our perspective, we needed to meet operational requirements in relation to the PUP payments and transitioning out to job seekers. So if we were being honest about it, we probably wouldn't have started at job seekers, but that's what we needed to do. And a separate piece of work is while we were delivering the solutions is we started looking at the operating model and started exploring the potential for a Centre of Excellence, and that's from the top all the way down. So I'm not going to cover a lot of the Centre of Excellence. The middle part there around the RPA project delivery is very much in line, what I suppose, with our software development lifecycle that we have in place. So it was easy for us to actually develop the solutions, and it's a really good fit with our own kind of software development. Next slide, please. Again, this is more, I suppose it was about supporting RPA, so the operating model. So we developed a vision. We provided kind of tools and processes for identification of potential solutions, a recommending of utilized, and then create an implementation roadmap in order to guide DSP through the RPA project lifecycle or governance lifecycle. And next slide, please. So a little bit more, I suppose, around the project delivery handbook, which I mentioned is very much in line with our own software development lifecycle. I won't go through it in Philip, that the slides are there. So if I'm pushed for time, I'll go to the next slide, please. So just some of the benefits. On the left, you can see some of the stats around each of the processes that we delivered and hours saved to date. The long-term, I suppose, benefits is we provided tools and guidance to design, deploy, and manage the process robotics at scale within DSP. As I mentioned, we have 4 solutions running at the moment. It actually saves BOMI officers an estimate of 6 hours registering and associating verified and unverified claims daily. But I suppose more importantly, allowed the officers to actually focus on higher value added activity, which is a big plus. They can actually focus on the actual awards rather than the registrations themselves. So the savings overall is a total of just under 7,000 BOMI officer hours saved to date, which is the equivalent to just over 4 FTEs. And an estimate of just under 11,000 officer hours will be saved annually, which is just over 6 FTEs. But there was broader, I suppose, benefits. There was immediate benefits for us actually as part of the engagement process. So when we were engaging with the business for delivering solutions, there was actually benefits delivered from an online perspective, but also from some of the technical solutions that we had in place because we could refine those, but also the business processes themselves. So the engagement from an RPA perspective, we got huge value from other areas of the business as well. Next slide, please. So I mentioned as part of the COE that there is actually a process that you can follow to when you're considering RPA solutions, and we followed this model for other solutions within the department to ascertain whether they're good candidates for RPA or not. So it's a very, very useful measure and actually gives you a scoring to see if it's a good candidate or not. Next slide. So I suppose next steps for the department, we've, I suppose, taken a bit of a step back in a sense that we've delivered the solutions, and the real benefit for that, particularly for the automatic registrations, as I mentioned earlier on, is the fact that they're now in place to deal with an increase in applications that we have at the moment. But there are other areas of the business that we're looking towards, like pensions and illness benefit. So we've started, I suppose, a number of exploratory projects looking at different areas of the business. We also want to focus on the operating model for the RPA and taking some elements of the COE and exploring them further. Next slide. And I suppose I just want to take an opportunity. I've gone through those slides very quickly because I know we've run out of time. But I just want to thank the business within DSP, I suppose, for their courage in engaging with us for these RPA solutions and delivering the business in relation to kind of COVID-19. I'd also like to thank the technical teams and other government departments who have worked with us. It's been absolutely phenomenal. And I'll say thank you very much to the audience.
Okay, thanks very much, Louise. That was brilliant. Are we going to bring in our wonderful assistant, Vinny? Are we going to have time for maybe 1 or 2 little quick questions for the gang here? I think you're on mute there, Vinny.
Only the 7th time this week. So Ashing asked a very quick question. What criteria do you use when choosing a process that will suit RPA?
I didn't catch that. You're asking what criteria
do you use when choosing a process?
Okay, again, it's to keep it simple, I suppose. I don't think I have long enough to go into the actual process that you do, but there is a process, just like one of the slides there that you saw just now. There is a process that we can go through. Keep it simple. Do something that you've tried and tested already, and then keep it simple and go for it. But I'm happy to talk to anybody afterwards if they want to see some of the detail in that question or any other question.
Yeah.
And then
Vinny, if I had to pick
very...
one aspect, I would say stability, a stable process.
Yeah.
Okay.
Yeah.
And then
Don't be over ambitious.
I know, Ashton, you mentioned that the bot never makes mistakes, but Ronan has a question here, and he says, what level of contingency do you need to retain? What should the RPA prove, or if RPA should prove inaccessible, how often do such RPA disruptions occur?
Yeah, when I say the bot doesn't make a mistake in programming the bot, that's a mistake that can be made. But once you make your mistake, or once you make your program for the bot, they will do exactly what it says in the tin. You do need to test it. You do need to come back and ensure that it is doing what you say. I suppose the contingency would be that you would go back to the previous method of doing it. But it will only be as good as what you program it, obviously. I don't know if that answers the questions, but again, I'm happy to take any of them offline.
Perfect. I'll hand back to Philip.
Yeah, I think we'll have to have another discussion because there's a lot of questions that are coming in. So we'll definitely do something again very soon in the future. I'd just like to thank all of the speakers, and I apologize for cutting across people. We were very, very tight for time and there's so much to talk about. So thank you very much to Kevin, to Aisling, to Kate, and to Louise for your contributions. It is really, really appreciated. The next session is going to be at 11:30. That's why we have to get off, because the bosses are coming on. So it's going to be chaired by our own boss, Robert Watt, Secretary General, Department of Public Expenditure and Reform, Vice Admiral Mark Mellett from the Defence Forces, the Garda Commissioner Drew Harris, Fingal CEO Anne-Marie Farrelly, Dr. Orla Quinn, my old boss from Department of Business, Enterprise and Innovation, Julie Cinnamon, the CEO of Enterprise Ireland, and Shirley Comerford, the CEO from the Public Appointment Service. And they're going to be talking about innovating through a crisis. So that's going to be a great session. So tune in for that session. And listen, thank you very much for joining us today, and enjoy the rest of Innovation Week. Cheers. Bye-bye.